So, why is ophthalmology? In ophthalmology, rheumatoid arthritis, this is the most common ophthalmologic error is keratoconjunctivitis sicca, episcleritis, erythema. Erythema होता है and there is mild pain, but it's normally considered painless in the questions. Scleritis, there will be erythema and severe pain, but diffuse and nodular it will be. Corneal ulcerations can happen, keratitis can happen, iatrogenic steroid-induced cataract, chloroquine retinopathy. RAPD, this is actually Marcus Gunn pupil, relative afferent pupillary defect. Swinging light test करते हैं. Lesion anterior to the optic chiasma, optic nerve and retina. Affected and plus normal eye, they will dilate when the light is shown on the affected eye. ठीक है. So light on the affected eye, it will dilate. Causes retinal detachment, optic neuritis, multiple sclerosis. Pathway of the pupillary light reflex. Afferent में retina, optic nerve, lateral geniculate body and midbrain. So this is like a role M. Retina, optic nerve, lateral geniculate body and midbrain. Efferent में Edinger-Westphal nucleus to the oculomotor nerve. So Edinger-Westphal nucleus is in the midbrain. Angioid retinal streaks, irregular dark red streaks radiating from the optic nerve head. There is degeneration, calcification, and breaks in the Brooks membrane. Causes are pseudoxanthoma elasticum, Ehlers-Danlos syndrome, okay, Ehlers-Danlos syndrome, Paget's disease, sickle cell disease, and acromegaly. So this is like PEPSA. So you can remember like this: pseudoxanthoma elasticum, Ehlers-Danlos syndrome, Paget's, and sickle cell and acromegaly. Okay. Then ARMD, most common cause of blindness in UK is adult RMD, central retina degeneration, bilateral photoreceptors, the drusen's होते हैं. Fundoscopy, retinal photography, most common in old age and females. Risk age in the 3 times, 75. And smoking, family history, CVD, hypertension, dyslipidemia, and diabetes. Dry macular degeneration, which is early, इसमें 90% होते हैं atrophic drusen, yellow spots in the Brooks. Wet is a late one, 10% exudative and neovascular, choroidal neovascular, leakage of serous fluid and blood, rapid LOV and worse prognosis. Clinical features, subacute loss of vision. There will be decrease in the visual acuity, difference dark adaptation, fluctuation in the visual disturbances, photopsia, flickering or flashing of the light, glare around the objects will be there. So differential dark adaptation, fluctuation in the visual distribution, photopsia and glare. Signs, Amsler grade testing करेंगे तो distortion of line perception होगा. Investigation, you do a slit lamp microscopy. Investigation of choice है ये pigmentary, exudative या hemorrhagic, that you will get to know. Fluorescent angiography, neovascular ARMD, anti-VEGF treatment करते हैं. Iodocyanine green angio, choroidal circulation, ocular coherence tomography, 3D of the retina. Now treatment, treatment, there is something called as an ARIDS trial. In this they had given zinc with vitamin A, C and E, dry ARMD के लिए. Anti-VEGF में ranibizumab, bevacizumab and pegaptanib. 4 weekly injections are there. RBP, laser photocoagulation. In head trauma, falling while walking down, fourth nerve palsy, superior oblique palsy, ventricle diplopia, outward rotation and torsional element to the diplopia, flame shade hemorrhage, hypertension, benign idiopathic hypertension, obese, headache, LP is diagnostic. इसमें tunnel vision होता है, papilledema, glaucoma, retinitis pigmentosa, then chorioretinitis, optic atrophy secondary to tabes dorsal and hysteria. Red ragged fibers, mitochondrial myopathy, optic atrophy, Kearsley syndrome, heart block, ocular myopathy with retinitis pigmentosus, mitochondrial myopathy, lactic acidosis, stroke-like episodes, MELAS, Leber's optic atrophy. Bilateral internal carotid artery displacement. Now, this is binasal incongruous hemianopia optic nerve. Pituitary tumors, bitemporal hemianopia, ये पता है. Angiod retinal streaks किसमें रहता है? Slappers. So in this you have sickle cell, lead poisoning, beta lipoproteinemia, acromegaly, Paget's tuberous sclerosis, numerous fibrosis, Sturge Weber, pseudoxanthoma, danlos, raised calcium phosphate, short people. In that also you will see angioid retinal streaks. Painful acute upper limb, third nerve palsy, PCA aneurysm, urgent neurological reference with neuroimaging. Retrobulbar neuritis, patient sees nothing, doctor sees nothing. ठीक है. So herpes zoster. अच्छा ये CMV retinitis, acute untreated HIV, brush fire like lesion and extensive retinal hemorrhage होता है इसमें. Herpes zoster, reactivation of varicella zoster virus area supplied by the ophthalmic division of trigeminal nerve. और रैमसे हंट में ईयर में होगा, यहाँ पे फेस में होगा. Vesicular rash around the eye, Hutchinson sign, rash on tip, size, nose, nasociliary involvement. Treatment antiviral देना है 7 to 10 days orally within 72 hours. IV for very severe reaction, topical treatment can be given. But topical and given and not given, it's herpes zoster, ophthalmicus. Then topical corticosteroids may be used to treat secondary inflammation of the eye. Application: ocular conjunctivitis, keratitis, episcleritis, and anterior uveitis. Ptosis, postherpetic neuralgia. Retinitis pigmentosa affects peripheral retina, funnel vision. Clinical feature: night blindness, tunnel vision due to loss of peripheral retina. Fungoscopy, black bone specule shaped pigmentation, peripheral retina. Mottling of RPE. Then Refsum's disease, cerebral ataxia, peripheral neuropathy, deafness, ichthyosis, Usher syndrome, beta lipoprotein, Lawrence-Moon-Bidel syndrome, Kearns-Sayre syndrome, and Alport syndrome. Primary open angle glaucoma, there is slow rise in intraocular pressure and it is symptomless. First line treatment, PGA, prostaglandin, eye drops. Second line में you can give beta blockers, carbonyl anhydrase inhibitor, sympathomimetics. Third, surgery and laser treatment. So prostaglandin analogs like latanoprost, there is increase in the UV outflow. There will be brown pigmentation of the iris and increase in the eyelash length. Myotics, pilocarpine, muscarinic receptor agonist होते हैं. There is constricted pupil, headache, blurred vision. They will also increase the UV outflow by खिंचवाइंग the ciliary muscles towards contracting them. ठीक है. Then beta blocker, sympathetic, decrease aqueous outflow. Avoid in heart and cardiac block and asthma. Brimonidine, alpha 2 agonist. These will decrease in the aqueous outflow, aqueous secretion and increase outflow. दोनों पे act करता है. Now again, avoid with MAO inhibitor and tricyclic antidepressant. Adverse effect, there will be hyperemia. Carbonic anhydrase inhibitor, they will also decrease the aqueous outflow and increase the outflow. Systemic absorption may cause some sulfonamide-like reaction. So PG analogs and myotics, these are the ones which will increase the outflow. Beta blockers are the one which have got only will decrease. Brimonidine and carbonic anhydrase have got dual actions. Acute angle closure glaucoma, severe pain with mydriasis, hard red eye, halos, semi-dilated non-reacting pupil, corneal edema. Direct parasympathetic, pilocarpine, contraction of the ciliary muscles, open the trabecular meshwork and increase the outflow of the aqueous humor. Beta blocker, timolol, decrease aqueous, alpha 2, decrease and increase. तो ये अप्राक्लोनिडिन या ब्रिमोनिडिन है. Now drugs which may precipitate acute glaucoma, angle glaucoma: anticholinergic drugs, tricyclic antidepressant, antihistaminics, anti-Parkinsonism. Sulfonamides, IV azolamide, decrease in the aqueous secretion. Definitive management, laser peripheral iridotomy. ठीक है. Then anterior uveitis or iritis, red eye, inflammation of the anterior portion of the uvea, iris ciliary body, HLA-B27, which is associated with Reters, Behçet's, psoriatic arthropathy and IBD. इसमें आपको ये anterior uveitis या iritis red eye देता है. Ciliary flush will be there, red rings spreading out, hypopyon, pus and inflammatory cells anterior chamber में. Urgent refer cycloplegics, atropine and cyclopentolate and steroid eye drops देते हैं. Argyll Robertson pupil neurosyphilis में दिखेगा small irregular pupil. ठीक है. No response to light but response to accommodate. What her Holmes-Addy pupil, now this is unilateral 80% dilated, once constricted remains small, causes diabetes mellitus and syphilis, degeneration of the parasympathetic nerves in the ciliary ganglion, denervation of the pupil and hence hypersensitivity to dilute pilocarpine. It is benign, usually seen in Holmes-Addy, मतलब women में दिखता है like this they do. Slow reactive to accommodation, very poorly to high. Syndrome, absent ankle and knee reflex and biceps jerk रहता है. Horner syndrome, there will be meiosis in this. H is, this is small Horner's. Ptosis. In ophthalmos and hydrosis, whenever somebody is putting horn, you just get irritated and constrict pupil. Heterochromia, congenital hornose and hydrosis. Apraconoplonaline alpha adrenergic agonist, pupil dilation in Horner's. Mild pupil constriction by down regulating norepinephrine, release at the synaptic cleft. Now, how to differentiate between the central preganglionic and postganglionic? Anhidrosis in the face, arm and trunk, stroke, syringomyelia, multiple sclerosis tumor and encephalopathy. Pre-face, Pankos tumor, thyroidectomy, trauma, cervical rib related to the neck. Postgangliotic, no anhidrosis, carotid artery disease, dissection, carotid aneurysm, CVT, cluster headache. Mydriasis is large pupil. Now this can be third home, trauma, iridoplasia, then pheochromocytoma, congenital, Holmes-Addy pupil. Topical drug I learned, tropicamide, atropine, sympathetic में amphetamine, cocaine and anticholinergic में TCA. So this has to be learned. Mydriasis, meiosis किस में होते हैं? Blepharitis, inflammation of eyelid margins. Meibomian gland, dysfunction, seborrheic dermatitis and staph, dryness of eyes होता है इसमें. Blepharitis, inflammation. Wait. Blepharitis, inflammation of the eyelid margin, Meibomian gland dysfunction, seborrheic dermatitis and staphylococcus. ठीक है. Drying of the eyes होगा इसमें. And bilateral gritty sensation. You give hot compression, BD, lid hygiene and artificial tears. CRAO is red AO, sudden upper visual loss due to thromboembolism and arthritis. Clinical picture is RAPD, cherry red spots. CRVO, increased sudden painless loss of vision, widespread hyperemia, severe retinal hemorrhage and stormy sunset. ठीक है. So central retinal artery occlusion, sudden unilateral visual loss, ठीक है, due to thromboembolism and arthritis. Reddy's sudden painless loss of vision, widespread hyperemia, severe retinal stormy sunset. Now diabetic retinopathy, hyperglycemia, retinal blood flow, abnormal metabolism, clinical significant macular edema, hard exudates within 500 micrometer of the fovea. Diabetic retinopathy, hyperglycemia, retinal blood flow, abnormal metabolic vessel wall, damage to the endothelial cells and the pericytes, ठीक है, and microaneurysm increases the vascular permeability. So this is 35 to 65 years old में. There is non-proliferative and proliferative. Non-proliferative is mild, more than one microaneurysms are the earliest sign. Then a non-proliferative moderate microaneurysm with blood, hemorrhage and hard exudates and cotton wool spots, which are soft exudates of retinal infarction. Severe this thing is blood hemorrhage with microaneurysm in 4 quadrant, venous bleeding in 2 quadrants, and IR-AME in 1 quadrant. Proliferation, retinal neovascularization, vitreous hemorrhage, fibrous tissue anterior to the retinal disc, most common type 1 diabetes, 50% blind in 5 years. Treatment 1. In case of maculopathy, intravitreal vascular endothelial growth, VEGF inhibition, retinal neovascularization, vitreous hemorrhage, fibrous tissue anterior to the retinal disc, most common type 1 diabetes, proliferation, 50% blind in 5 years. Treatment in case of maculopathy, intravitreal vascular endothelial growth factor, non-proliferative में regular observation, severe versus very severe pan-retinal laser photocoagulation. Proliferative retinopathy, pan-retinal laser intravitreal VEGF, vitreoretinal surgery भी कर सकते हैं. So this is important between the non-proliferative और proliferative कौन से होते हैं, ये important है. Herpes simplex, keratitis, dendritic corneal ulcer. There will be sharp, red, painful eye, red, photophobia, epiphora, visual acuity इसमें कम होगी. Fluorescent acid staining में epithelial ulcer दिखेंगे. Refer to the ophthalmologist and you can give topical acyclovir. Hypertensive retinopathy, Keith-Wagner's classification. So इसमें there will be arteriolar narrowing and tortuosity, increases the light reflex and silver wiring. Second is AV nipping. Third is cotton wool exudates and flame and blood hemorrhage. And fourth is papilledema. So one is arteriolar narrowing and tortuosity. Second is AV nipping. Third is cotton wool exudates, flame and blood hemorrhage. Fourth is papilledema. Keratitis साइट थ्रेटनिंग रहता है ये. बैक्टीरियल स्टाफ ऑरियस सूडो एरोजेनसा फॉर्म कॉन्टैक्ट लेंस. फंगल अमीबिक अकैंथोमो सॉइल कंटामिनेशन, पेन आउट ऑफ प्रोपोर्शन. पैरासाइटिक ऑन्कोसर्कल केराटाइटिस. वायरल इज हर्पिक्स. एनवायरमेंटल फोटोकेराटाइटिस वेल्डर्स. कॉन्टैक्ट लेंस अक्यूट रेड आई. क्लिनिकल फीचर्स ना इसमें रहेगा रेड आई, फोटोफोबिया, ग्रिटी, हाइपोपियन. स्लिट लाइम सेम डे रेफरल. स्टॉप कॉन्टैक्ट लेंस. टॉपिकल एंटीबायोटिक्स लाइक क्विनोलॉन. साइक्लोपेंटोलेट फॉर पेन. डाइक्रोसिस्टाइटिस ट्रीटमेंट सिस्टमिक एंटीबायोटिक्स, IV एंटीबायोटिक्स पेरिफेरल सेलुलाइटिस के लिए. ऑप्टिक neuritis, multiple sclerosis, diabetes and syphilis. Now unilateral hours 2 days, red descent, pain on the eye movement, relative afferent pupillary defect, abnormal delayed central scotoma, abnormal delayed visually evoked potential. Treatment high dose steroids 4 to 6 weeks. Prognosis more than 3 white matter. 5 years risk multiple sclerosis 50%. Orbital cellulitis, infection of the fat and muscles posed to the orbital septum, URTI and high mortality rate. Redness and swelling around the eye, severe ocular pain. Visual disturbances, ophthalmoplegia, pain. Treatment is IV antibiotics. Papilledema causes space oculi in lesion, malignant, idiopathic, hydrocephalus, hypercapnia, hypoparathyroidism, hypocalcemia, vitamin A toxicity will cause papilledema. Post vitreous detachment, there will be no pain or loss of vision. Now, this red eye, this is important. Keratitis is important. Red eye, there will be acute angle closure glaucoma, anterior uveitis, scleritis, conjunctivitis, subconjunctival hemorrhage, and endophthalmia. So acute angle closure glaucoma में severe pain होता है, decrease in the visual acuity, semi-dilated pupil, hazy cornea, oval shaped. Anterior uveitis, acute pain, blurred vision, photophobia, small fixed oval pupil, ciliary flush. Scleritis, severe pain, conjunctivitis, purulent discharge, bacterial, clear, viral. Subconjunctival hemorrhage, there will be history of trauma or cuffing. Then endophthalmitis, visual loss followed by intraocular surgery. Small fixed oval pupil, ciliary flush, anterior uveitis. Hazy cornea, semi-dilated pupil, acute angle closure glaucoma. Sudden loss of vision. Sudden loss of vision less than 24 hours. So there can be ischemic vascular amaurosis fugax, large artery, small artery, VTE, TIA, curtain coming down, ischemic optic neuropathy, ocular of short posterior ciliary artery, damaging optic nerve. ठीक है. Then CRVO, central retinal vein, increased age, glaucoma, polycythemia, hypertension, severe resting hemorrhage. CRAO, TE arteritis, pupillary defect, cherry red spot on the pale retina, vitreous hemorrhage, diabetes mellitus, bleeding disorder, dark spots, retinal detachment में flashes of light and floaters. Posterior vitreous detachment and retinal detachment, vitreous hemorrhage. Posterior vitreous detachment में flashes of light and photopsia, floaters often on the temporal side. Retinal detachment, dense shadow starts peripherally and then goes to the center. There will be wheel or curtain over a field of vision. Straight lines appear curved. Central vision loss. Vitreous hemorrhage, there will be large bleeds, space SLO, moderate bleeds, numerous dark spots, and small bleeds में there will be floaters. ठीक है. So this is important. Vitreous hemorrhage यहाँ पे भी लिखा है. डायबिटीज मेलाइटिस, ब्लीडिंग्स. Third, cranial nerve palsy has motor fibers to the levator palpebrae superioris, superior, medial, inferior recti, inferior oblique, pupillomotor fibers to the iris sphincter. So, depending on the cause, third, cranial nerve function of the iris sphincter, spared if there is ischemic cause, likely like CVD and diabetes. And if it is affected, then there will be some compressive lesion must be suspected. ठीक है. So there will be urgent intracranial scan and you have to refer to the neurosurgery.